Welcome to the Beauty of Breathing podcast, where we explore the wonders of optimal breathing. I'm Renata Nami, a dedicated mom, entrepreneur, and myofunctional therapist committed to embodying the principles I advocate. Having recently undergone a tongue-tie release and palatal expansion, I'm thrilled to guide you through the transformative journey of embracing the beauty of breathing, effortlessly and through your nose. Let us know how much you enjoy the show by leaving us a review. We are live. Hello, everybody. Welcome to the Beauty of Breathing podcast. I have a very special guest with me today, Dr. Neel. Welcome to the Beauty of Breathing.
Well, hello. Good to see you, Renata. Good morning for me, but good afternoon for you.
Yes, you are in a really cool place today.
Yes, I am. I'm on an LA trip, and I'm down here. I was hanging out with Dr. Sarush and Nora, doctors Sarush and Nora Zagi yesterday. Actually, Leslie from TBI, and then now I'm over here hanging with Sanda at the Breathe Institute in Calabasas, and it's a beautiful. If anybody who hasn't been here, I mean, again, I'm talking to preaching to the choir. It's so green and so beautiful here. It's a gorgeous place.
I cannot believe I still have not been there.
Oh my gosh, you haven't been here.
I have not been to LA. I have not visited the Breathe Institute yet. I need to.
We are now finding out what the theme of this conversation is, which is planning Renata's trip to LA.
100%. I have to make it. There's so much out there that I need to see, and so many friends that are there that I need to visit. So we've been talking for some time. We're live on Instagram now. Welcome, everybody. You guys can post any questions that you may have for Dr. Neel over here on our Instagram feed, and I'll read over to you guys. So we've been talking for some time right now about having this conversation and doing a podcast episode. You are just so brilliant. And every time you speak, my mind just goes, because it just makes so much sense the way you explain things. Would you mind first introducing yourself to the crowd? And then second, introducing our topic, what we're going to be covering today.
Yeah, well, first I want to say thank you for just setting this up, and then all the messages back and forth, and you're doing so much in your life and managing all these beautiful things. I mean, there's all these exciting things with Airway Circle and with the Beauty of Breathing, and then I'm so thankful. And then I'm also gracious to Sanda for hosting me here at her spot here in Calabasas. And she said, sure, happy you can do your podcast. And then I'm interviewing her for my podcast, which is something I do. And it's called Compromised to Alchemized. And it's really about taking compromised airways and turning them into alchemized airways. And because this is a big part of who I am, I'll explain that, is that if any of you haven't read The Alchemist, it's a beautiful book by Paulo Coelho. Amazing.
Who is Brazilian?
Brazilian, yes, that's right. And so this is fitting. And he's brilliant. He talks about it's more of a parable or an allegory, but I'll spare that because you can all read it. But basically it's taking what's lead and turning it magically into gold alchemically through a series of reactions. And so I'm really excited in this phase of my airway work to talk more about the way that we can be alchemical in our approach to healing, which is less linear, less about just the procedures that we do, and more about the process we go through of inner and outer transformation in our spirit, souls, and bodies to help ourselves become more whole. But I have a background as a chiropractor, but then I niched in and created the field of integrative airway and feeding chiropractic. I've told many people truly the word I'll use soon is an integrative stomatognathichologist, because that's all about the head, the neck, and the jaws, and the glossopostural syndrome and how it connects to the body. And then SOFT is the stomatognathicoscillatory oscillatory fascial touch system that I created. So I'm just excited to talk a little bit more about what I do, but really, and then in a little bit, I'm gonna go grab Sanda so she can say hello to everybody too.
Yay! How exciting! Awesome. So last time that we spoke, you mentioned the floor of the mouth and how important and mislooked it is.
Yeah.
Nobody is talking about the floor of the mouth. How does that relate, or is it related to your diaphragm, your pelvic floor? Tell me about the floor of the
Yeah.
mouth.
Yeah. When you're totally good leading questions, because I feel like in one way, we all like traverse this terrain. You as orofacial myologist, this is your like bread and butter. This is what you look at all the time. So I feel like I'm just providing like a deep, intricate look into how does the oral diaphragm, which is the floor of the mouth, work? How does it create a place for where when it's tense we can release it and that can influence the body? But I talk about the interconnectivity, which is, the whole body is this conduit and this two-way street. So yesterday I released somebody's parathyroid gland, and when I did that, that's what dropped the floor of the mouth tension where it wasn't
What?
dropped,
No
especially
way.
anterior. Yeah, totally. Most people who have this rigid anterior portion of the floor of the mouth, whereas the posterior is little tense. If
Uh-huh.
it's really tense on the anterior aspect, yeah, I used to look at the mentalis and the platysma and all these muscles and the SCM and the scalenes, but then I've really figured out that's often when people lie on their left side, that parathyroid gland drops with gravity, or the thyroid gland. And if I can release the fascia on the thyroid and the parathyroid, often that anterior portion of the floor of the mouth that will not get loose gets loose. And it's crazy to see it when you do it, because I'll go back and forth. If I'm really good, I can, figure it out. But sometimes I'm just going to put on like a second pair of gloves because I'm going to work on the body and go back to the mouth. But yeah, it's pretty amazing how this connectivity is just throughout with so many things, with not just organs, but other parts of the body.
So, can a tongue tie, a tongue restriction, affect this tension not only on the floor of the mouth, but also around the thyroid?
Yeah, absolutely. Yeah, and I'll kind of, in one way, I feel like the conversation about the tongue tie is a good place to say the ties do that, and then as I saw on somebody yesterday, the torii that exist, both on the palatine bone and often in inside that lower arch, that can mimic a tie, and that can actually create this rigidity into the floor of the mouth. And maybe they have a grade one tongue tie, or maybe not. Maybe there's no tie. But if they have tori, which and we can go into all, of course, you can go into all the reasons on a chemistry level as to why they happen. But for me, I'm not looking to uh, scrutinize in that moment what it is. I can then say, okay, but if that tori is creating distortion to the floor of the mouth and there is no tie, the goal is the same. How can I get that floor of the mouth tension to loosen? Because it's tense for so many reasons, regardless of whether or not there are oral ties. But the tori, that's what I'm gonna go really deep into that in my course. But I feel like the floor of the mouth is such an expansive topic, and there's so many things that affect it. I shared a couple times, but 75-year-old man with hearing aids, when I had them take those out, that's what really loosened the floor of his mouth.
What?
So I could finally loosen it more, so that I could loosen the pterygoids more, so that I could release the temporal bone, so that his TMJ could relent. So
Wow.
it's like an unwinding process to see what's connected to what. But I've kind of really put it into a system of understanding, so it's not this seemingly almost impossible place. So not only do I figured out like this system where I have like 70 points on the body that you can look, but I have the really common environmental or lifestyle stressors or aggravants that we can look at and kind of toggle or experiment with while we're evaluating whether we're doing body work or the myofunctional assessment, to see what changes in that terrain of the floor of the mouth. Because if it changes, it's the oral diaphragm, and it gives mobility to the tongue, to the pterygoids, to the buccinators, to the it also lets the palatine bone come up a little bit, and if the palatine bone can align a little bit, which is often low, right? So almost on every airway issue, tongue tie or not, the palatine bones are sitting too low in the back, right? And it's that high vaulted narrow palate on the anterior with the maxilla. So if you can get a little bit of releasing into the palatine bones, then you can start to shift the orientation of the roof of the mouth. And some people are like, well, but why? Or, I mean, and most people I think are not asking why, but because if that occiput's stuck, and if those suboccipitals are too tight, and if they're stuck in glossopostural syndrome, if they've been that way for any more than a month, like meaning if you're over a month old, you've had a month plus 35 weeks of compensation for the origin of those ties happening at 4 or 5 weeks in utero, right? So that means you're still going to need to disentangle the fascial tension from the tongue to the bipalatine bones to the occiput. So this is a pathway. The floor of the mouth is a pathway to freeing up all that without ever having to touch the occiput, which is pretty cool.
Oh my God, this is crazy. For those who do not know, whenever we're talking about torii, and if you want to check if you have any bilateral or unilateral torii, you have to look on the floor of the mouth. So open up, lift your tongue up, and you can palpate with your finger on the gums underneath the teeth, go all the way around. That's supposed to be smooth. If you have any extra bone coming out, that's torii. And it can look as several different ways. And we believe that that bone builds up there because of the amount of pressure that you create with your teeth. So pressure builds bone. Those people who are big clenchers, you're going to notice that they have way more torii than somebody who does not. I used to have patients come in and be like, oh my gosh, I just noticed this. Like it just came up. It didn't just come up. It's probably been there, but you just noticed. But this is so interesting to me. I had no idea. So people that have torii are more likely to have tension. Is that correct?
Yes.
Okay.
Absolutely.
So people who clench more are more likely to have tension.
Mm-hmm.
What are some things that increase clenching or grinding in patients?
Well, I mean, there's also the other part where, torii take up the floor, they take up the tongue space as well on the maxilla, right? So they make the tongue not want to go there, So the torii are pretty much like, I call them the stalactites or the porcupines of the mouth. The tongue doesn't want to go near them because it's not comfortable, and there's no ability for the tongue to stabilize on that bone. So it stays away, which creates tongue rigidity, which creates floor of the mouth rigidity. So first of all, it's like a loop, right? Floor of the mouth tension creates, often the environment to which we want to clench or grind. Of course, we can talk about, retrognathic jaw and all of the airway issues that could start with tongue tie, with narrow palate. But then, people with stress, people with, work environments or any kind of environment where they feel stress. Well, a lot of them say, I've always felt it in my head and my neck and my shoulders, and I clench my jaw. And and they're like, yeah, I'm in the most, difficult time of my life. And I think it started, when it started, which is 3 months ago. When I look and I evaluate them, I say, well, because you have a significant tongue tie and lip and or cheek ties, we know that some of the origin of this tension started in utero. But there's this overlaying stress, which is the stress that they're dealing with, that can add layers of tension and clenching and grinding. And then there's also, if they're going through any pathogens or parasite cleansing, they could even be from the parasite, from the, mold, from the fungus. But it could also be that they're cleansing and detoxing from those pathogens. So in the detox process, they stir up those toxins and they're having a Herxheimer reaction, and that's creating more tension, which is why I typically say to like people who are going through, tongue tie release preparation or palate expansion or jaw surgery, I say, let's give a buffer and make sure you're not detoxing from a parasite or a heavy metal while you're doing the preparation, because you're going to create a lot of tension and stress. So that's, I think, an indirect cause of the clenching and grinding. Those are just at least some of the highlights.
Very good. So this extra bony growth that we're talking about, you can have it on the floor of the mouth. That's the bilateral torii. It's usually on both sides. But you can also have on the roof of your mouth. That one is called palatal torus because it's usually just one. And you can also have something called the exostosis. And I want you guys all looking in the mirror, checking it out right now. If you look in the roof of your mouth, it's supposed to be smooth. If there's any extra bone coming out, it looks like it's coming out from your nose. That's a palatal torus. And it usually starts very small and it starts growing as you grow up. I actually have exostosis. Exostosis are going to be on the outside gums of your upper and your lower teeth, or one or the other. But if you pull your cheeks up, I know whoever is listening and not watching right now won't be able to see me, but if you pull your cheeks up, it's on the gums above the teeth on the top. They're extra bone that just grows, and all from usually lots and lots of pressure that you're applying with your teeth. We have some questions coming in. Somebody's asking, any connection with bedwetting? We've tried chiropractic care, but it didn't work. My son had his tongue tie snipped when he was 2 days old, and I'm trying to decide if he should have it revised.
And how old is he right now? So I'd wonder how old is he?
I know we have so many questions. We need to see him. Let's do a consultation because it is very hard to answer a question about a specific individual. So maybe we can generalize. A child who's had a tongue tie release before, first of all, there's always a chance that one, the tie was not fully released. Two, that it's reattached. Three, that the patient did not have the proper therapy, not just myofunctional therapy, but all the other approaches that are needed depending on the age of the patient. Maybe that was not done. I would never jump into a second tongue tie release before looking at everything first. So at least with my patients, I always request a sleep study. I request a CBCT, which is a 3D x-ray that goes all the way around you. On that x-ray, we can see everything. We can see tonsils, adenoids, turbinates, the TMJ health. We can see the width of the palate. We can see where the hyoid bone is. There's so much information from that x-ray because I can't recommend for that patient to go get evaluated for another tongue tie release. For example, if they have huge tonsils and adenoids, if their airways compromise, a release is going to be impacted. It's not going to work very well. I always say that there's 3 pillars to what we do. One is the airway. That's why we need an ENT in our team. So making sure that this airway tube is free and clear for air to go through. Pillar number 2 is the skeletal structure. So we need to work with an orthodontist or an airway dentist who's going to make sure that the upper and the lower jaw are grown to its full potential. And then the third pillar is the muscle. So that's when you need a myofunctional therapist to make sure that the muscle has enough tone, has enough strength, and is functioning properly while you're doing regular function, which is chewing, swallowing, breathing, all of those things. So those are the main 3 pillars. Of course, depending on what the patient looks like when they come in, we're going to have to refer this patient to different professionals because everybody in this field holds a piece of the puzzle. It's not one thing that's going to fix it all. The reason why the Mayo Clinic is so successful is because they have several specialties looking at the same patient and making decisions for that patient. And we all know that healthcare is usually not like that, how it works, right? You guys go to a certain professional and they we all wear the goggles of our profession. That is why we created Airway Circle, so we can invite different professionals to tell us what they see so we know when to refer. And we know how to look at this patient in a more generalized way. So in terms of bedwetting and chiropractic care, can you give any light to any parents out there? What are some of the problems that chiropractic care could help a child who's bedwetting?
Yeah, absolutely. And so I would say kind of leaving the conversation about all of what you said, you covered so much ground. So well, let's say considering what does somebody do if they have no access to or they haven't been to an airway evaluation or concurrent with it? What can help? And so often a sacrum misalignment, specifically at S2. So it's not the top of the sacrum, but yeah, there's a place on the sacrum that those who are really specific in their chiropractic work, they can evaluate that one specific segment, and sometimes releasing that, adjusting that can affect the nervous system to help with bedwetting. And then there's other areas that it could be, related to as well. Something I've seen is if there are like kidney misalignments or stomach or colon, even bladder, if the bladder is tipped and misaligned, then I can, do fascial work to release it so that the brain can talk to that area of the body in a better way. So you might not find that in a traditional chiropractor's office. You could get the sacrum adjusted there, and some chiropractors do that, but you're more likely to get visceral work like that from, an osteopath or some craniosacral therapists or craniosacral fascial therapists, or also some PTs who have done training at the, Upledger Institute or the Barral Institute. And then, if they're a Rolfer, which they've done some massage therapy and they've specialized in structural integration. Anyways, there's people who work on organs, and if they do, then they can sometimes be a huge help when you're looking at try to help mitigate that. And then I kind of wanted to segue into back to what you were saying, Renata. It's like I think it's so fitting that you created, with creation of Airway Circle, you created like a platform that's very energetically resonant with the myofunctional field, because I look at you all as liaisons and bridges of care, ambassadors of care between all these providers. You're not only a provider who is a specialist, if not only like the most specialized in this field, but you're also the bridge and the connector. So, in my area, I can function as that because I'm kind of the one who connects people. However, in most areas, I love that we can look to what you do as that bridge and liaison, because you can speak the language of, you need a little, it's like a palette, a palette of paint. You need a little bit of this color, a little bit of that color. And you, of course, defer with great respect to the providers for their expertise surgically or orthodontics, body work. But it's like somebody needs to know that all these therapies and modalities exist, because one, people can go crazy when they're trying to look for that on their own. Yeah. Two, you could wonder, what do I even start with? Do I start with this or this or this or this or this? And some people are trying a bunch of things that aren't really helpful. And so I find so many people are so helpful when you can narrow down the focus for them. And then I want to do another, hopefully, to say that, this is one of the things I'm most excited about, is like, this is a era in which I think you all as myofunctional therapists need to get way more credit for what you do, and from us providers, but also from people. And a lot of people they're excited about myos doing your work. And I wanted to just quickly intro, if I could have Sanda come in and say hello for a minute or so.
Yes!
We're at her place. She's amazing. And she's coming in a minute, so you might hear the door open. But I just wanted to say that, of course, who am I to introduce her? But at the Breathe Institute location, she goes back in history with that, back to the OG days of starting, the Breathe Institute. She can't, so Sanda has such a history, not only with that, but of her own healing journey. So some of you know well who she is, but Sanda Pinkerton graciously has allowed me to use her space. But I wanted to, of course, have her come say hello and just talk for a few minutes with you, Renata.
Thank you so much. Okay, guys. So Sanda is actually one of my mentors. Oh my goodness. Hey.
Good seeing you, Renata. How are you doing?
I'm doing great. Welcome.
So good seeing you, my dear friend. Dr. Neel just asked me, when did we met first? And I think, what was it, 2018? Or when did we meet first, actually?
It was a long time ago. In person, we were in North Carolina during the Breathe course. It was a
Yes.
long time ago. I
Yes.
learned so much from you guys. A lot of the things that what I do are things that I've learned from you. So, first of all, thanks for paving the way. I know how much you have worked and how much you have fought for this field. And I know that I would not be able to be doing what I'm doing if it wasn't for you. So, thank you so much for everything that you have done for all of us.
Well, you are so kind, and in all honesty, I think you are doing a phenomenal job spreading the word about what this method of treatment it is, which is wonderful because the more voices we need out there, the more important it is for all, it's not only the practitioners, but as well as for the patients to understand what is the role of this method of treatment. So thank you. Thank you for all that work.
Of course. And one of the things, there are so many myofunctional therapists out there. I keep talking about, there's no standardized training, unfortunately. And we become who we are in this field based on the amount of courses that we have taken, based on our experience. And you are one of the most well-rounded myofunctional therapists that I have ever met. There are several of us whenever we first start, we're giving a list of exercises. And it's not just about that. And you have taught me to be able to look at the patient as a whole and look at everything else. So, can you just tell everybody a little bit about when did you start? When did you fall into this field? And what got you here?
Honest, I think it's thank you for saying for what you just said. I think that's crucial of understanding that each patient which comes for support to us, it's a unique creature out there. It's a unique human being. And although, guidelines on how to treat and what are our goals with those patients presenting with myofunctional disorders to us, it's extremely important that we need to have really a very clear understanding of those facts. However, when it comes to treatment, we need to have knowledge, love, and wisdom to bring the necessary flexibility for every single patient coming our way. And that's why I do not believe in list of exercises, as everybody knows. Everybody who knows me, they do know that. There is not such a thing like a list of exercises starting from A to Z. Lots of times in my own clinical experience, what I learn it is A and D and maybe E and F. And that's totally based on, what the patient needs. However, what I think is extremely important, it is to have a great screening tool, to have a better understanding what the patient needs and the sequencing of treatment. Not all the patients which are referred to us, they necessarily need to start with myofunctional therapy. They
Yeah.
need, yes, absolutely. And then if we are open enough, flexible enough, and having enough understanding of, what's going on with that particular patient, they might be referred to an OT, a feeding therapist, Dr. Neel skills, absolutely evaluating everything, what's going on the posture, on the gait, on the cranial bones, and every single piece, I call them like puzzles. So all those needs to be put together. So sometimes our role it is more to be like an advocate for that patient, to educate that patient in the role and what is necessarily to be done and what's the sequencing. So I think those are really important steps. In terms of learning, that's our journey. Okay.
That
Never
is beautiful.
stops. And the most I think we acquire our knowledge from other really very inspirational mentors we have. But then the other way it is we learn from our patients. So with that being said, I think it's the list, it's limitless.
Yes, 100%. Well, thank you so much for sharing with us and for stopping by a little bit. This
Thank
has been such an honor to have you here. Thank you. I love you.
you. Love you too, Dr. Neel. Thank you for this.
Thank you.
My goodness, guys, if you guys have not met Senda, please go to the Birth Institute and look her up. Go visit her in LA.
Yes.
Thank you, Dr. Neel.
Oh yeah, that was good. This wouldn't have been complete if she wasn't on. That would have been lacking and missing. So so glad that we could do that.
Thank you. That's so special. I love her. I've learned so much from her. We have a question. We were talking about the CBCT earlier. Somebody asked, do regular ENTs use cone beam CT scans? Is it just the ones that are more well-versed in this newer airway information? Usually, I send my patients to a dental office to get a CBCT because the amount of radiation is going to be way lower than if you have an ENT request a CBCT. So usually I will send the patients first to the dentist, get a CBCT, and after that we go to the ENT with that diagnostic information that they can look at. Somebody asked, will this be added to myomeats? I'm definitely gonna want to listen again. So myomeats is a secret. Not a lot of people know about myomeats. Myomeats is our secret myofunctional therapy study club, a monthly meeting that we have, but it's only available for MyoCircle graduates. MyoCircle is our advanced course in myofunctional therapy with Airway Circle. So I can add it to myomeats for sure. Somebody said, have seen local myofunctional therapists for evaluation and exercises. She referred to a dentist who does tongue tie release, did Zoom and sleep apnea tests, and now just need to book the release. I'm nervous. Have constricted esophagus, swallowing issue, and singing makes me cough and tighten up something. I hope you're going to a speech pathologist who's doing a swallow study maybe. I think that before tongue tie release, you may need a little bit more testing.
Yes. Yeah, I would absolutely also recommend a vocal PT. There's not many of them. I have a few that I know and refer to, but a physical physiotherapist or physical therapist that specializes in vocal. But as soon as I say that, I realize I don't want to stress you out. Like if you don't have these resources and you don't know what's going on, it just, like Renata said, it's so important that you have someone who specializes in those areas of the body to evaluate and see, is there anything we should do and address before? Because this preparatory phase is going to dramatically impact, possibly, not always, but possibly dramatically improve. It will impact it no matter what, but the only way you know if it's going to help is if you have that ability to get it checked and see what that person says.
All right, perfect. Yes, definitely. Make sure that both the dentist and the myofunctional therapist know that you have swallowing issues. Yeah. Somebody said, whoa, where do we find and connect with more vocal PTs?
Yeah, there are very few of them. I don't know. I'll probably have to get you, Renata, I have to send you something and then we could just post it later.
Okay.
Because there are very few of them out there.
Perfect.
I function in a lot of ways as one because I work on the airway, the vocal cords, the scalenes, there's all these areas of the body that you need to work on in order to work on the apparatus of singing, the apparatus of the voice. And because I not only care a lot about singing because I'm a singer, but I love taking care of creatives and singers. And so in order to evaluate that, you really need to know the mechanics of singing, producing sound. You need to know what genre they're in, what they're going for. So I would say that if you kind of similar, if you don't have a vocal, there's just not many out there. But if you have somebody that can focus and work like a myofascial worker that can specialize in working on all those areas, then you're going to have help there.
Perfect. Let's work our way down to the kidney and people who are having adrenal fatigue. But before we go there, I do want to say, since I see that there are many professionals listening to us, if you are a healthcare professional and you want to have access to hundreds of lectures that are all related to airway, from breastfeeding to craniofacial development to hypermobility, palatal expansion, tongue tie release, join Airway Circle. It's a multidisciplinary online study club. We meet weekly every Thursday night, and we have incredible lectures recorded in our vault with some research for you guys to learn more and more and more. For those who want to join, send me a private message and I will give you guys a code for a free month if you're listening to this right now. And then if you are a patient wanting to learn more, you can go on Facebook and search Airway Circle Patients. We have a group over there with over 1,000 people, patients and professionals alike. And it's just a community. It's not medical advice. It's a community where parents can go and share their experiences, or somebody, patients can ask questions. And it's a really amazing resource that we offer to the community, as well as our directory if you want to find a professional near you. All right, Dr. Neel, let's go down to the kidneys and floor of the mouth.
Would love to. Yeah. So the kidneys and the floor of the mouth, how are they even connected? Well, I could just say hands down, if you have any airway issues, if you're somebody who has a tongue tie, or if you're somebody who has any, narrow palate, if you have any of this tension in the head and the face and the neck, kind of talking to people out there, if you don't know you have an airway issue, how do you know? Because if you haven't been checked. But if you have trouble, keeping your mouth closed and TMJ, jaw pain, if you have any, other that tension and stress in the neck and hamstrings that won't loosen, all these things, there's so many areas to mention, then you're very likely going to have a kidney misalignment on the right side of your body. So your right kidney is more than likely going to be misaligned. About at least 99 out of 100 of the people that I've seen, the thousands that I've seen, have that right kidney misalignment. So in the Western world, we talk about the kidney as this organ, and then we also mention the adrenal gland as a separate organ. I agree. We need those definitions in one way. However, if we talk about the kidney and we say we remember that it's the renal gland, and then we say the adrenal means on top of renal. So when we look at the anatomy of it, it's the adrenal sits on top of the kidney. The kidney in and of itself handles electrolyte balance, blood filtration, stamina, endurance. So often the adrenals get all the credit for, being fatigued, but the kidney is so fatigued in a lot of patients who are mineral deficient or can't absorb very well. One of the reasons could be because their kidney is misaligned fascially. So I would say one of the biggest considerations here is that, so I see a lot of patients who have come in and they've taken tons of supplements, and I love that they have, because I love natural care, holistic care. And so they may have taken like all these adaptogens, right? And I give credit to adaptogens because they save people's lives from being fatigued and, can't move well, can't think well, brain fog. But sometimes that fatigue is happening not due to the adrenal gland dysfunction directly, but due to the fact that the kidney is not functioning well and the kidney is misaligned, because the adrenal gland is going to come along for the ride on that myofascial distortion or misalignment. So there are so many times when I see somebody come in and they said, I've tried everything and I don't know what to do. I just feel like I'm going to need to take these supplements for the rest of my life. Well, of course, chiropractic and myofunctional, there's so many things that are helpful for that. And for certain people, that's what they need. They need these amazing disciplines. But there's some people who just need that kidney released. And when that kidney gets released and that myofascial tension leaves, very specifically, then you can see their energy levels resume. They're able to process and handle those electrolytes and minerals, and they're able to then convert these energy sources that we normally would convert, breath being one of them, light being one of them, and of course, water being another. And then I like to talk about those as being more of our essential nutrients. I like food, but honestly, I can go a long time without it. We can't go long without water, right? We can't go long without sun and light. And how long can you go without breath, right? So I can only hold my breath for 4 minutes. That's it so far.
That's pretty incredible.
Yeah, underwater, deep down, that's it. But I'm working on expanding that. But that's still 4 minutes. I can go 4 minutes without breathing, but that's not breathing. So that's the reason that I really scrutinize kidney alignment. Now, what I then started to realize is, yeah, I could release that kidney, and then that person lying on their back, that kidney's aligned. Then I started to get them, have them stand up, go sit down, and that kidney would remisalign. Why is that? Their feet, their knees, their ankles, all the way up. And then if they lay on their left side, that kidney would misalign due to gravity, versus the right side, the kidney wouldn't misalign. So just to get deep in that, if I wasn't releasing the kidney misalignments of that visceral system, if I wasn't freeing the kidney in the positions that it was tied up in, standing on the left side, then they would go on having kidney issues, which would relate to often adrenal fatigue. Not only that, but the kidney undoubtedly tightens the floor of the mouth. So on most of my people, if I'm looking at the floor of the mouth and I want to loosen it, you got to free the kidney. And so if the kidney frees lying on their back, awesome. But they get on that left side and their rib cage compresses and the kidney misaligns again. Often they have a harder time breathing on that left side. They can't sleep on that side, so they favor the other. That's positional releasing of the kidney. So there's a whole lot to that. Now, I think like to kind of rewind it a little bit and talk about the kidney, to say that I don't want to say to anybody out there that if you're dealing with adrenal fatigue, it's automatically the kidney. But for most people who come in, or most body workers that I train, or anybody, I tell them, when's the last time you had your kidney released? Most people look at me and they're like,
what?
I didn't know that was a thing. And so I've only had one or two people ever tell me. And that's because I know this amazing osteopath, and he does that. He's been to some of my trainings, and he also is really intuitive. You might be intuitively getting body work from somebody really intuitive, and they don't even know what they're releasing. But for me, my intuition guides me 100%. But my intuition doesn't often scrutinize on a very logical, systemic way. So that's why I've codified a system of assessing for and evaluating what's going on with the floor of the mouth. So I highly recommend, like, being aware of it is just the first step, so that you can say, maybe there's something else out there other than all these supplements that I'm taking. But if you're somebody who doesn't even know that you could be taking supplements to help this, please, ashwagandha, that's an amazing,
I love it.
biloba. So take those things as awesome foods that we can eat that are herbs. Just know that those herbs might be a Band-Aid, but hey, we all need a Band-Aid. Everybody who has a kid, right? That kid needs a Band-Aid, and if you take it away, they will be sad and cry. So I'm like, you can have your Band-Aid, but just know that there's no bleeding. So in a minute or tomorrow when we do your bath, let's take it off so that you can get air and light to that area. Well, my analogy is, if you're wearing a Band-Aid of an adaptogen that's covering up a kidney misalignment, I'm a kid too, so I'm going to talk to myself as a kid. Neel, you're a kid, Neel, it's okay to take that ashwagandha, but just know tomorrow, the next day, if you want to really get at this, we're going to have to take that away so we can uncover the root cause, which could be a kidney misalignment. So that's what
I love that analogy. Somebody's asking, how long of a process is it to release the kidney? I'm not clear in the modality. Is it kind of like a craniosacral type of intervention, rolfing? What is the method? I realize it's all connected. And I guess based on what you're saying, it will be a process because you have to address all of the misaligned organs and structures.
Well, first of all, I would say, yes, I'll name a few people. You could potentially find an intuitive osteopath, a craniosacral therapist, craniosacral fascial therapist, or somebody that has gone to the Chickley Institute, the Baral Institute, and some other visceral trainings. And the process is interesting because it can take one session to release a kidney, or it could take several. It could take 10. However, because I've developed a system where it's actually it's a 9 series of body work that I go through the body systematically called embryology. I've created a protocol for addressing kidney distortions that's based on airway origin. So I've created that doesn't exist. So right now I would encourage you to, if you're a person who is seeking help with this, I am in LA and the Bay Area and in Redding. And so if you come to California, any of those 3 cities, I can do a session for you, because my sessions are usually an hour and a half to 2 hours. And if we take a long session and maybe even do a back-to-back one day and then that night, or one day and the next day, we can sometimes get to the root of it and clear it.
Mm-hmm.
But for those of you, again, that make it to me, I'm training more people, because this protocol for addressing the kidney isn't out there except for who I've trained in it. And then also, if you're a provider and you're looking to find out more about it, sure, you can come to my bodywork trainings. But let's say you're a myofunctional therapist, or you're a dentist, or you're some therapist who isn't going to do the hands-on nitty-gritty releasing of that. My floor of the mouth interconnectivity unveiled course that I'm launching is really like where I'll do much more teaching on this too. So I start that this Wednesday. That is tomorrow, July 17th, starting tomorrow. So it's going to be 6 weeks of 90-minute live sessions with Q&A, and there's going to be resources that'll come at you. You'll also get tongue press, which is my digital course that I made on how to free the tongue and do activations to release the floor of the mouth. Things that I figured out through self-experimentation, and also adding on layers of learning about this work for 8 years. So tongue press is for anybody with a tongue. So anybody out there, any person. And
perfect. So it doesn't have to be a professional.
No, tongue press is for anybody out there. It doesn't have to be a professional. And tongue press you'll get inside of floor of the mouth. But tongue press, my main video, is an 8.5-minute daily routine that you can view. And then you can go through how to free your tongue, floor of the mouth, and all these areas, and unwind the body with that perspective. So it's a really amazing resource. And it's I'm going to post a link for you, Renata, and it's going to be $63. And the floor of the mouth is definitely more geared towards providers, practitioners. But I would say if you're a healer or you're guiding anyone in healing, I have like one person, she's a parent, and she's taking it because she has, like, if you have more than one kid and you need to know, how do I help them on a day-to-day, and you can't get to endless therapies, you can take my course for $560, and it's going to give you a wealth of information of how to decode your body, decode healing. So I think it's really approachable. I mean, obviously the tongue press is much more affordable, but floor of the mouth is a really deep dive into how can you understand the body from an airway perspective on all these different planes of fascia, muscle, lymphatic and cranial and facial and structural and energetic. And I talk about environmental stressors that are influencing the floor of the mouth, like a hearing aid, or like when somebody has a light sensitivity and you have to turn down those lights for the floor of the mouth to loosen. So the kidney is kind of definitely a place that I talk a lot more about there. And yeah, the end on that, to answer that question more specifically, you might, if you can't get the right kind of releasing kind of body work, it will go on forever. That kidney won't release. But if you can get the right kind of care, it's going to free up so much sooner. So as long as you find somebody who prioritizes intuition and is willing to take time, this is not something you can usually get done in a 5-minute, 10-minute, 15-minute session. I love you all. I love all you out there, chiropractors. You're my people. However, we gotta go longer than that. We got to approach usually 30 minutes, 45 minutes. So just as a helpful clue, if you're in a session and somebody is taking that time and they're also meticulously evaluating the kidney, hey, if they're doing that, you're with the right person. So you're going to find some people can help with that.
That is so much good information. So if I want to take any of your courses, do you have a website? Do I reach out to you on your Instagram? What's easier?
Yeah. So first we can, definitely on my Instagram at Dr. Neel Bulchandani. If you go to my links, you'll see the clickables on how to go to the floor of the mouth course or the tongue press course. And then we'll kind of share the ways that you can get to there more directly. So easy to find it if you go there, and you can always reach out in Instagram and shoot me a message if you have any more questions.
Perfect. We'll make sure that we add this in all of our show notes. Somebody just said this is also fascinating and helpful. Thank you, guys. Run right now. As soon as we hang up, run over to your favorite podcast platform. Look up Beauty of Breathing. Start following us and go ahead and leave us a 5-star review and what you think about this show so we can keep bringing more and more information to you. Thank you, Dr. Neel, for hanging out with me today. I really appreciate you joining and sharing all of this incredible information that we all need to know.
Well, it's been a blast. I've really enjoyed the hangout with you, so I can't wait to do another one.
Let's do it. Thank you, everybody. Have a great day. Bye. Thank you for joining us on another insightful episode of the Beauty of Breathing podcast. Make sure to join the conversation on our Instagram page, Myo Moves, and continue exploring the fascinating world of airway health with us. Until next time, let's breathe deeper, live fuller, and discover the beauty in each breath. Quick disclaimer: the Beauty of Breathing podcast has been produced for entertainment, educational, and informational purposes only. All of the content, views, and opinions shared by our hosts and guests should not be a substitute for medical advice. Please consult with your healthcare professional for any medical questions.